We're live now, Chair.
Thank you. Good morning, everybody. Boda Pawb. Croeso, welcome to Powis's Health and Care Scrutiny meeting. We've got a very busy agenda today, so I'm going to crack on. And can I have apologies, please?
Yes, Chair. Apologies for absence have been received from committee members, County Councillors Carl Robinson and Alwyn Evans, from Cabinet members, County Councillors Jake Berriman, Glyn Preston, Jackie Charlton, Rafe Devlin, Tom and David Thomas, and from Head of Children's Services Sharon Powell, and from Powers Teaching Health Board colleagues Duncan Ashton and Caris Williams.
Okay, thank you. Any members of the committee got any declarations of interest? If you come across something further down the line in terms of when we look at any of the financial issues, if you know anyone in those services or receive those services, please feel free to register your interest at any time if you haven't realised it yet. Disclosure of party whips. No. Okay, minutes from last time. We've got the minutes from the 22nd of October. Um, at that meeting, we had a fairly full present set of people. So could I have, well, does anyone have any comments, first of all? If not, please could I have a proposer and a seconder for approving those? Councillor Josie, Gareth, are you happy to? Josie, are
Yeah.
you proposing? Yeah, Gareth,
Yeah, I can propose, yeah.
Yeah, happy to second, Chair.
thank you. Could I have a show of hands if they're all approved then, please? I think that's everyone I can see. Yep, happy for those to be approved. Thank you both. Let me just click back. Okay, I'm going to leave the work programme, although we're fairly on track for where things are going for our next meetings, although maybe slight adjustments to dates. So our first main item is the Corporate Safeguarding Board activity reports, and we have this on a regular basis. Thank you, Councillor Church, for bringing this today. We have got a really tight time frame today, and we've all read the report, so um, it's yeah, unless there's anything burning in terms of headlines that you need to highlight to us, we don't really need a summary of that today. But is there anything you wanted to just highlight in terms of key issues or things you think we should be aware of in that?
I'll leave it to Nina as the director to highlight anything that she wishes to, bearing in mind your point about your busy agenda.
Thank you, Richard.
Chair,
Nina?
Chair, I'm happy to go straight to questions. Thank you.
Thank you. Right, councillors, we did have a couple of questions. So please put hands up. I know, Councillor Chris. Oh, you're on mute, Chris. Still on mute.
Yep.
There we go.
Hi. In the report, thank you for the report, Nina. In the report, there is a mention about the school stabbings in Carmarthenshire. And I just wondered, are there any lessons learned that are coming out from that would be useful for schools and Powys?
Thank you, Chair. Happy to respond. And that this is why we bring these kind of matters to the attention of the Corporate Safeguarding Board for discussion. Councillor Chris, you're absolutely right, because we need to make sure that we take on board learning from incidents and from child practice review, as adult practice reviews, etc., that happen elsewhere, obviously within our region, but further afield as well. So we make sure that we look at any learning that come through the subsequent reviews and take those on board here in Powys. So I don't have the details of what those recommendations or actions are here today, Councillor Chris, but I can provide you assurance that we do take that into account as part of the board and oversee that.
Okay, thank you for that. Can I just ask one further question, if I may? Obviously, within the report, you mentioned about volunteers policy in relation to training for violence against women, domestic abuse, and sexual violence. Welcome that. What I didn't see in the report is how we're performing overall with our permanent staff and teaching staff. There has been some concerns about low numbers in particular groups. So I was just trying to get some clarification on how we're performing to date. But in future, it would be helpful to have that as a standard item, in my view, of how we're performing in relation to that metrics. Thank you.
Yeah, thank you, Councillor Chris. And we've just had the next corporate safeguarding board actually yesterday, and we did look in detail at those figures, both in terms of safeguarding training for within schools and corporately as well, but also for Voucher SV as well. So we do have those latest figures, and I'll take an action to make sure that we include those figures in your activity updates moving forward. Corporately, very high levels in the 90s, I think towards the mid 90s in terms of corporate mandatory compliance, which is excellent. And the schools, we went into quite a bit of detail yesterday at the board, an improving picture, but still more work to be done across that. So I'm happy to go into more detail within the report that will come from the meeting that was held yesterday. I'll take that as an action. Thank you, Councillor Chris.
Thank you.
Any other questions, councillors? I've just got a quick question that there's reference to increased movement between home education and school. I just wondered whether or not this is a sort of hybrid scenario where children are having a mix of, say, I don't know, 3 days in school, 2 days home education, but also whether or not you get given the breakdown of children that are in receipt of services from children's services who are included within those figures of children that are either exclusively home educated or on some kind of hybrid scenario.
Thank you, thank you, Chair. We do receive some information. I don't think we have all of that information coming to the board that you've just spoken about, but it would be held. So we look at, for example, we were looking yesterday at the numbers of and ages and age groups of people that are becoming elected home education, but also those that are moving back into education as well. And one of the things that was picked up at yesterday's meeting, for example, was we did see quite a movement, I think in September, of people going back to mainstream schooling. We did have a discussion yesterday as well at the board about in terms of children looked after and child protection register, etc. So we don't have that information coming through to the board as yet, but I'm happy to take that as perhaps something that you ask as a scrutiny for us to consider appropriate, because we just got to be mindful, haven't we, in terms of numbers, etc.
Yeah.
But I'm happy to take it as a way to consider.
If there is anything that's more than, just the odd child because of their specific needs, if there was a trend or if there was a significant theme, then I would be interested in those figures. But I would be happy to make a recommendation that that's just something that you consider, whether or not there is a theme or a trend.
Yep, that would be great. Appreciate it. Thank you, Chair.
Thank you, Gareth. Please, could you make a note of that as a point that we raised?
Yeah.
Councillor Chloe.
Thank you, Chair. Thanks, everyone. I noticed the backlog of deprivation of liberty safeguards assessments, and obviously there's serious challenges around this. I can read in the paper that it's a challenge. I just wondered if any action was planned to be taken to address that backlog. Obviously, steps have been taken to try and deal with the situation as it is now, but when there's any action that's been taken to deal with the current situation where there's a lot of people waiting.
Chair, we've got the head of service here, Sharon Fruin. Would it be okay, perhaps, if I asked Sharon to come in and respond to this one?
Hi, Sharon. Oh. Is there a technical issue? I can't see.
It looks like Sharon can't unmute. Oh, there you go.
There we go.
Sorry, I've got a few technical issues with my sound. Could you repeat the question? Sorry, and happy to answer.
Yeah, no worries. So I was talking about the backlog relating to the deprivation of liberty safeguards assessments. There's been lots of new referrals and more completed assessments, and action's been taken to try and address the fact that there's a challenge there. But with the backlog in place, I just wondered if there was any plans to try and deal with the current long waiting list that's already there.
Yeah, it's a common theme across Wales, the backlog, and we're almost a victim of our own success as we've raised the awareness, which is absolutely right to do. More people are putting in applications, which is great. So the things that we've been doing, we've now got a rota for our best interest assessors, who currently sit within the community teams. It's really difficult to free up their work from the day-to-day work in the community teams. We've now got a rota system, which has given us additional capacity. We continue to use the ADASS prioritization framework to manage the risks so that we're actually addressing those most at risk first. And we are looking at the structure across all of the service to ensure that we've got the right resources in the right place, and we're looking to increase capacity around our court work, which will include the best interest assessors.
Brilliant, thank you. If I may, Chair, I've got one other question, which hopefully will be a quick one. And I don't know if I missed it in the report, but I just wondered if there was some more information about safeguarding risks for care leavers and homeless young people and what support is in place for those groups.
Nina?
Thank you, Chair. We've got Joanna Harris from Children's Services. Could I just maybe ask for Jo first if she's got any comment to make? Sorry, it's not quite your area though, is it, Jo? Sorry, apologies.
No, it's not my area of expertise, but all of our care leavers have an assigned personal assistant, and they're all supported if they want that support until the age of 25. We not only support them in terms of their PA, but we also provide financial support to all of our care leavers too. But if you needed any further information, I could definitely go back and get that for you.
I think for me, it's good to have, because I don't have a lot of knowledge around this area, it's just good to know there are some systems in place to help with these groups. So that's good. Thank you.
Absolutely, yeah.
Is that a topic that does come to the safeguarding board?
In terms of homelessness and care leavers,
Care
etc.
leavers, yeah.
Yes,
Yeah.
it does. Yes, we
It-
get that
under
information coming
under
through.
the homeless housing update, is it?
It does, yes.
Yeah, thank you. Thanks everybody. I don't think there's any more hands up on that. So thank you for your contributions on that. And then if we can move on to the next agenda item, which is the Q2 capital. Sorry, I've just lost my agenda. Q2 capital report. Thank you for bringing this. It's a fairly comprehensive report in terms of where you are in capital spend over this financial year. So I don't think we need a presentation on it or a summary. But I think, are you happy for us to go to any questions we've got? Thank you. Councillor Gareth, I think you had a question on this one.
Yes, thank you, Chair. It's not a question, it's just a point, really. We got the original budget and environment improved, but we haven't got the expected spend to date by the end of quarter two. And I assume the capital budget is profiled against each of the projects on spend. We've got the actuals, but we haven't got the expected spend to date, which I would expect to see. And the other question is trying doing some quick maths now, 1 point whatever million in adult services and children's services. What is the expected spend by the end of the year? Is it 250,000 unspent at the moment? Will remain in budget after the commitments? Is that an expected figure of the year end, or do we expect that we're going to fully utilize the full budget?
Nina, which officers will be answering questions on finance? I know I can see
Yeah.
James. James, do you want to just introduce yourself as well and just say what your job role is, just for the members of the public, please?
Yes, good morning, everyone. I'm James Chappell. I'm the Chief Accountant, so I oversee the capital programme and technical part of accountancy. So Councillor Gareth has a question around the capital budgets are not profiled. They're all held in one period because of the way that they're a bit sporadically spent. They're not, but the full year budget is what we expect to spend at the point the report is written before the end of the year. Obviously, we work with the services to reprofile as often as possible. There's been a big push now after this Q2 report with a substantial amount of reprofiling across there, but the anticipated spend is the budget in year.
Does that answer your question, Gareth?
Well, it answers the question, but not to my satisfaction. Because I just think it should be profiled, but that's just my view.
Do you
Chair.
want,
Sorry.
I was just going to say, Gareth, do you want to give some thought to the reasons why you think it should be profiled? We can discuss them and then we can see whether we.
Because in my view, we need to have an understanding of which of the schemes or which of the areas are actually spending it in line with their expected spend. At the moment, we can't judge that. And I don't want to look at the overall budget scenario, but if you look at it, there's 113 million uh, capital budget for the year, of which only 20 million being spent by the end of quarter two, which is halfway through the year.
Yeah, okay. So in terms of where we are on this now, I think my overarching question would be to Nina and to senior officers within health and social care is, has the spread of the spend been what you expected? Are there any have there been any hurdles which has pushed things further towards the end of the financial year that you've had to mitigate? And so is this what you planned?
Chair, I'm happy to come in first and then invite Sharon and Joe to just briefly cover their area, respective service areas. I mean, I'm not an accountant, don't work in finance, etc. But I think from a service area, it would be very difficult to provide a monthly profiling for capital expenditure. It is my practical experience and knowledge of kind of working with capital. These tend to be projects that, perhaps just, you spend once or twice a year. It's not like it's regular expenditure. They're more like to be project-led example work that we're undertaking in terms of equipment or spend or buildings, etc. So I do query whether the use and practicality of being able to profile, but that's just my point of view from a service perspective. In terms of the appendix, in Appendix A, each header service has provided commentary. And I think that's really where we need to be looking and challenging ourselves as to whether we're on track for expenditure. And that's where we should be flagging as services is where we think we're not, and then working with our finance colleagues in terms of, any environments that might be required, etc. But if it's okay, Chair, perhaps Sharon and Joe might be able to just provide a couple of sentences for each of their service areas.
Thank you.
You'd like me to come in first, Chair, Sharon?
Yeah,
From
thanks,
adults.
Sharon.
Thank you. I'd take Councillor Gareth's point, and I think in adult services, our biggest commitment is around our Paris Home care homes, and I'll take that as a task to provide additional narrative in our heads of service commentary for next quarter. But we're expecting our full budget to be spent.
And in terms of the timings, is this what you expected
Yes.
to be towards the end? Okay. Thank you. Joe?
Yeah, I'm happy to come in. Yeah, we're confident that all of our money will be spent by the end of March. Often at the beginning of the financial year, we're out to tender, securing the contractors that are able to do the work. So lots of that work happens at the beginning of the financial year, with then the majority of the spend happening from September onwards to the end of the financial year. And that's quite normal for our capital projects. Fully spent last year and will be fully spent this year.
Yeah, thank you, Chair. And just as note that sometimes obviously notification of grant monies, etc., are received throughout the year as well. It's not it would be unusual to know at the beginning of the year what exactly grant money we're going to have available. So that still continues and is notified throughout the year as well. So again, making that whole profiling picture very complicated.
Sorry, Nina, I'm going to have to disagree with you on that one. I think, I think Joe's given a very good explanation of children's services budget, which could easily be profiled with most of the expenditure being in quarter two, quarter three, and that would make the report so much more informative from my point of view.
I think they will note that, Gareth. Councillor Pete, I see you had your hand up before. Did you want to come in just quickly, if that's okay?
I was just going to emphasise the Appendix A and ask Councillor Gareth what he would like more to see in Appendix A because of all of the reasons of profiling. I'll throw an additional one into the mix. Any work that we're doing in-house also interacts with demands in the education service that tie that work in. mainly to half terms and the like. So there is a whole load of complexities that make accurate profiling really difficult. Potentially, I guess we could possibly look at a quarterly basis, Nina. That might be possible, but if you're looking at a monthly profile, that would be challenging.
Okay, I think I would like to speak with Gareth further on this to make sure I understand really what the sort of, even if this was done, what's the benefit of it. So let's leave it with us for now, and then we will come back whether that with a recommendation in due course if we feel that there is one. Councillor Chloe.
Thank you. Just a quick one, really. I think I'd welcome a bit more information about the climate change and nature implications on this. It states in the report that a significant proportion of the capital schemes directly contribute to climate change and nature initiatives, but they're not really pulled out, so we don't really have detail about what that is. It wasn't clear to me from reading the rest of it what they were. So if it's possible to have a bit more detail, not necessarily for this one, but next time, I think it would be good for us to be able to see that.
Yeah, but just in terms of our social care hat, yeah. So that may be something that you might want to take up with another committee in terms of their side of things.
Sure, thank you.
Okay, I think that's it on the capital report. So the next one is the revenue forecast report, which we've said in sort of the pre-meeting we could probably spend a good hour on this. Again, just looking at adults and children's services, I think it would be, rather than have an introduction on the whole financial picture for Powys in terms of forecasting, it would be helpful if we could have just the overarching headlines and the themes, the surprises, the concerns that you've got as portfolio holders and heads of services and at director level. So I don't know who wants to start on this. Nina, did you want to sort of introduce it and then hand over where relevant? But I would like to hear from the portfolio holders as well on this one, please.
Yeah, no, thank you, Chair. Happy. And I think I'd just like to bring the attention of the committee again to the appendices of this report. And that's where you'll get the detailed narrative from the heads of service in terms of both where we are, where we're expected to be, any work and actions and mitigations that have been put in place, etc., in terms of the budget. So just I don't think I'll repeat any of that, perhaps, Chair, and hand over straight over to Sharon and to Joe and to portfolio holders for their comments.
Yeah, so should we start with children's and can I welcome Councillor Sandra to committee? And Sandra, is there anything you wanted to say regarding the forecast for children's? Oh, just lost Sandra then. Has everybody else lost Sandra, or is it just me?
No, can't hear.
Okay, Joe, sorry, I'll jump to you, Joe Harris, if that's okay.
Yeah, happy to give some headlines. So the narrative, as Nina says, is within the appendix of the report. So during quarter 2, we were able to achieve.
Oh, sorry, Sandra, we lost you. We lost you. So
yes, apologies. Can you hear me
sorry,
now?
do you want to just? Yeah, sorry, Joe. We'll go back to Sandra.
Sorry, Joe. Thank you. Thank you very much. I don't know what's the matter with my connection today. Apologies. I will be brief. I just wanted to put one or two things into perspective, really, regarding our budget, and just remind members. I know that they're fully aware, but just a brief reminder. When Councillor Sue and I shared the portfolio and first come into this position, we were told that we were 10 million in the red. And to be honest with you, the amount of work that our staff have put in to bring our budget to where it is with 11K in the red at the moment is commendable for our staff. I just wanted to raise that issue and to make sure that everybody knows that the staff put
the child at the centre of all we do. There are things outside of our remit regarding placement costs, which are exorbitant, as we are all aware. But just to reassure that our staff do go through systems systematically, test and try as much as possible before they enter into any new any new changes that they bring in. As we know, our grow our own has been successful and is reaping rewards. It's taken time to embed, as with most of the changes that are put into the service, and they are tested, monitored, and carefully reviewed as they go through the process to make sure that the child is safe throughout this process. We have I won't go through the document because I know members have read it all, but there are processes that we are changing and embarking on. Our adopting services, our fostering services, just to name a few. We are trying to bring our children back into county as best we can. We are working with housing to see if we can, and we've been successful in placing 4 young people in Brecon, and that's very successful. So there are things that are going on behind the scenes, and staff continually moving forwards in trying to reduce the budget, and reassurance for this committee that Sharon, our head of service, does go through each and every invoice and double check it before it's approved by her, before it goes through the system. So I know that we've got a lot on the agenda, so I'm trying to be brief and grab and push everything into it. I hope that makes some sense, and
Thank
you
you.
get the picture. Thank you.
Thanks, Sandra. Joe, is there anything you wanted to add before we go on to any questions on children's?
I suppose the picture in quarter 2 is much better than the picture was at quarter 1, and I think that the service has been very successful in as like Councillor Sandra says, in returning children home, and we've been able to now achieve a significant number of the savings during quarter 2 that we had set ourselves, and we've had some really positive progress in terms of that delivery during quarter 2, and that continues during quarter 3. The only thing I would say as well is that we've got more children now in-house foster placements than we had at the beginning of the financial year, and that of course then has a positive impact on our budget. But in contrast, we have had a number of children been taken into care during quarter 2 and quarter 3, and some of those children are very complex with high placement cost attached to those. So, yeah.
Thank you. Councillor Gareth.
Yeah, thank you, Chair. My question, I think, follows on from what Joe's just said. As we're now 75% through, or more than 75% through quarter 3, do we have an update of where we are in projected outturn for children's services by the end of the year? I think staff need to be congratulated for reducing the projected overspend by 800,000 in quarter 2. Do we have an indication what the position is going to be at the end of quarter 3?
Nina, you've got your hand up.
Yeah, thank you, Chair. Obviously, we've got the quarter 2 update in front of us as a committee, as in front of yourselves as a committee. We'll have the next update, Councillor Gareth, early in the new year, so we'll be able to give a more update on the quarter 3 position as then. As Joe has said, we have
but no indication as of yet.
Well, we obviously track expenditure through, and as Joe said, we have had some increasing numbers and in terms of some children coming into care, etc. But the exact details of that we'll be able to report on in quarter 3.
Yeah, that's fine. Thank you.
Any other questions, Gareth? Councillor Chris? You're on mute, Chris.
Sorry, Chair. I just wanted to pick up on a particular point. I think I've raised it before, but I just wanted to get further clarification. On page 45 of the report, there is a section there which gives with children's services and the forecast outturn. And it goes that the overspend is 2.63% of expenditure over budget. Is that due to demand, or is that due to the costs of these placements for children on there? And are we seeing an increase in demand, and do we expect that to remain the same or to vary going forward?
Who wants to take that one?
Do you want me to come in there?
Thank you, Joe.
Yeah, so our demand has increased since COVID significantly, or almost double, and that remains the same. So our demand is absolutely high, but it's no higher now during quarter two than it was in quarter one or in the previous financial year. The demand in terms of looked after children, our looked after children figures have gone up during quarter two and quarter three. And some of those very complex placements, those costs have risen significantly. So I think that it's, in answer to your question, it's not around demand, it's around the numbers of children coming into care and the costs of those placements.
So are those placements very limited for these particular children with this particular need, and therefore is the market in our favour or is it against us?
Unfortunately, it's against us, Councillor Chris. It's that when we have these numbers of children with these very complex needs, it's extremely difficult, A, to find a placement, but also for those children to have stability within that placement. We've had experience where providers are giving up on our young people, even though those extortionate costs are being charged to the local authority. Their needs are so significant that we have to move those children on. And we've got a couple today that we're looking that we've been served notice on those placements, even though they're astronomical in terms of their prices, and we're looking for placements that can meet those young people's needs.
And
When, sorry, go
sorry,
on.
Chair, just the assurance that those costs have been looked at in relation to our health colleagues, so that we are proportionately allocating the correct balance between health and social care needs.
Thanks, Chris. That's
Absolutely.
exactly what I was going to say as well about complex
Right.
needs. Go on, Joe.
Absolutely. Yeah, we work really hard to make sure that that happens. And one of the examples I've just cited, Health actually make the 56% contribution to that weekly placement cost. So we absolutely do look to our health colleagues
Okay.
to make those contributions towards those placements. Yes.
Thank you for that.
And you mentioned about there being a couple this week, Joe. Am I right then? And are we right in thinking that actually this is a very small amount of children that this picture relates to in terms of the high complex, high cost care packages?
Absolutely. The majority of our looked after children aren't in those very high
No.
cost placements. It's a small cohort with those very complex needs where we're looking for those external placements that cost us so
And
much.
do you have discussions with your colleagues and peers in other local authorities? And are they in a similar position in terms of a very small number of children who are in very high cost because of complex needs? And are there any shared experiences or with our bordering counties, are there any shared resources or anything like that? Has that all been looked into?
We do work really closely with our colleagues from other local authorities across Wales, and especially with the not-for-profit agenda from Welsh Government. All local authorities across Wales are working together to see how we approach that. Lots of local authorities are developing their in-house provision, which is exactly what we're doing, so that we're able to meet young people's needs in county. And yes, the other local authorities experience exactly the same things as we do in terms of those children with those very complex needs. Yeah.
Has there been a sharper rise in the increase in costs as we get closer to the not-for-profit agenda coming into place?
I think it's incrementally increased over the last sort of 2 to 3 years. Yes, there are costs now that we've never seen before as we approach that not-for-profit agenda implementation. Yes.
And do they give you the breakdown of those reasons for those increases? And are you able to go through those line by line with
Yeah.
a question mark as to whether or not they are reasonable increases or whether they are um, forecasting increases due to what's coming down the line with not-for-profit?
Yeah, we absolutely routinely ask for that cost breakdown line by line in terms of what those costs are made up as. Unfortunately, sometimes those costs are made up of where they've said that they can't place alongside our young person. So we're having to reimburse the placement, the provider, for the fact that they can't place alongside. But yes, we absolutely go through
Sorry,
line by
what do you
line.
mean by place alongside?
So where a provider could maybe have two young people in their residential home, given that our young person potentially has needs that are so complex and so demanding, the provider is unable to use that second bedroom for a second child. And then those costs are being added to our placement cost until they feel that it's safe enough to be able to match and have another young person alongside our young person. But we do go through it line by line, and we have had some success in negotiating costs. And a reduction in costs, but yeah, it's a provider's market at the moment.
So sorry, I know I'm really drilling down here, but as it's a provider's market and when they're making those decisions as to whether or not they can place children side by side, and you may not be able to answer this question, but do you feel that, as you would say, when we make decisions within Powys, that we're putting the child at the heart, are those decisions they're making to do with children's safety and the best experience and the best outcomes for those children, or are their decisions more financial driven in terms of their own costs?
I think the complex needs of our young people cannot be denied, and I think that we would be in agreement with that, provided that it would be unsafe to place alongside in some of those circumstances, yes.
Thank you. Thank you, Joe. Thanks for answering those questions. And I really appreciate the detailed knowledge that you've got on that. Sandra, did you want to come in on that?
Yes, please, if I may. As you're aware, we meet with WLGA. Letters have gone out regarding this and expressing our concerns and the rising costs of young children. It is a national concern. All the local authorities are in the same position, and we are very, very much aware that this is high on our agenda when we meet with WLGA and other counterparts within other local authorities. So we're very much on the case, and we're making representation higher to try and bring this to the forefront to reduce costs and do what we can to safeguard our youngsters. Thank you.
Thank you, Sandra. Councillor Josie.
Sorry, Chair, my apologies. I thought I'd lowered my hand. It was just a brief reminder regarding the not-for-profit agenda, and you covered it both very well, and Joe's response was great for that point of time. So sorry, I should have lowered my hand, but thank you, Chair.
No, not to worry. So we'll move on to adults now in terms of that, which gives us about 15, 20 minutes on that. But I think from the financial officer's perspective, I think our overarching comment would be for both services is how you're going to reflect these pressures within the budget coming down the line for next year, which I am sure is highly up on your agenda. But if there's any comment that you can, provide us with on whether there's anything you're doing differently this year, for example, based on challenges this year, or is it just everything is becoming slightly more heightened, or it's the same trajectory. But thank you, Joe. Thank you, Sandra, and I'll hand over to Sharon and to Councillor Pete.
I'll open up briefly just to introduce many of the comments around children's services apply across into adult services as well. The increased demand that, as you know, we hold initially at risk is starting to materialise, and we're seeing additional pressures on the funded nursing care costs where providers are increasingly highlighting the discrepancy between their costs and what is actually funded. To mitigate that in part, we've followed a similar process to high schools and have been working very closely with a number of providers to look at a deep dive of their costs so we can actually come back with evidence along with other authorities to support putting additional pressures onto Welsh Government to review those figures. Moving forward, this is Q2 reporting, and confident, having had discussions with officers, that the savings will be delivered or mitigated, but by the end of Q3 we will have a much clearer picture as to which of those two categories things fall into. Officer giving you a very detailed summary of where things are within Appendix A, I don't really wish to repeat those. I'd rather see you have time to ask questions. So I'll pass across to Nina.
Thank you. Nina or Sharon?
I come in, Chair.
Thanks.
Thank
Thanks,
you.
Sharon.
Sharon, Head of Adult Services. I think I don't want to reiterate what Councillor Pete has already said, but just to give some highlights, the challenges still do remain the same. Picking up on your comment, Councillor Chair, around what are we doing differently. Our bed position remains the same at around about 550 beds occupied for older adults. The difference that I'd like to point out is that the complexity is meaning that we're using more and needing more EMI nursing beds, and there is a reduction in the residential beds. Councillor Pete touched on the fact that we scrutinise every package. We have a fair cost of care, and we have a costed care plan that we drill down into from every provider. We meet every morning to discuss high cost placements and any queries we have around the nature of the support being provided regarding nursing support. We drill down into that and then pick up those conversations with our colleagues in PTHP to ensure that the right funding source is allocated to that package. You will see that we have had some successes, and that is some of the things that we will continue to do differently, and that is by actually making sure that we provide the right level of support with the most efficient level of support. So dom care increased use of supported living to try and reduce the impact that the higher cost residential and nursing home placements have, but also to deliver those better outcomes for people. You know, the focus is still on maintaining people's independence, maintaining people be in their own communities and closer to home, rather than in the accommodation-based support. I was going to mention the savings that Councillor Peter said, and we have monthly efficiency tracker meetings, and that we know that position has improved, and there's yet further improvements to come, which will hopefully be demonstrated in Q3. But happy to take any questions.
Thank you, Sharon. Unfortunately, yeah, Amanda's had to leave us, so you're left with me for the next 5 minutes. Can I just start with a question to you, Sharon? Of the savings that have been identified outstanding, 3 point whatever million, and you've given us the assurance that they will be achieved in this year, what's the consequences of achieving those savings or making mitigations into the 26-27 budget? Will there be a saving available in that, a further saving available in 26-27?
There will be, we know that there will be some rollover into 26-27, especially around the opportunities and the locality model, and that's because of the complexity of managing those managements of changes, but they will be delivered early on. Many of the savings that we are focusing on this year around right sizing of packages and the funding body review, that will continue, that work will continue in some elements into 26-27 with our programme of work around the transformation, but we'll be more focused on specific work streams around prevention and increasing independence through our personalised development plans in supported living.
Okay. Yeah, that's fine. Thank you. Just to follow on from my question around capital, do you actually profile when you expect this identified efficiencies to be made during the year? You know, is the 1 million saving achieved by the end of Q2 in line with your expectations? Were you expecting it all to be in Q3, Q4, or would you expect a more even spread of those efficiencies?
Some of them would be profiled because of they're quite clear kind of processes and programs of work. Others are programs of work that would span the whole of the year. I will be honest with you that we would have expected to see more performance in some areas, and that's why we've drilled down into the efficiency tracker meetings around our right sizing and the funding body review, we've uncovered that there are some issues that we've had with processing and recording of some of the savings. So there's a connection between our decisions through our care practice forum and then how our back office systems work to capture those changes in packages. And so we're doing some work with our finance team and finance admins to make those systems more effective and efficient and more timely, so we can report in a more real time, in real time, rather than the lag that we've had.
Right, thank you. Councillor Chris. You're on mute, Chris.
Yes, sorry, Chair. The mouse is playing up a little bit on the. Thank you for the report. I'm just going to turn to page 44, if I may. There's a bullet point on there about delays in health funding, and I wanted to just unpack that a little bit more, if I may. Because it's got ongoing difficulties agreeing the appropriate health funding in a timely manner. What impact is that giving? How is those difficulties being addressed? And likewise, from our side of the equation, our assessments to facilitate discharge in line, and how are we performing?
Thanks, Councillor Chris. The first thing I'd like to state is that the care and the support provided to the person isn't impacted by those delays. That comes first and foremost. The subsequent conversations we have with colleagues in the health board around the funding streams is something that happens separately. So I think that's probably an important point to mention. As you'd imagine, some of the processes are quite complex in ascertaining somebody's need. So we do sometimes go back and forth with clinicians and professionals at trying to understand what the person's need is and then getting it through the right panels to have those agreements. It's something that is greatly improved, but there are still some difficulties around applying, for instance, the CHC framework. We have had some support from some external agencies to review the processes, and we've got an action plan to improve that process. So we're confident that those things will improve, and we have a clear escalation process now where there are disputes so that we can resolve them more timely. But again, I'd probably say that the care and support does not change for the person. That is put in place, and decisions are made retrospectively around the funding. Regarding assessments and delays around hospital discharges, we've seen a significant improvement over the last 3 months. We've realigned some of our resources from our community teams and enhanced our hospital discharge team. And as of last month, we've seen a 47% reduction in the assessment delays. So those are delays to those people waiting a social care assessment. So we're in a pretty, I dare say, I don't want to jinx us, but we're in a fairly positive position going into the winter months, although the winter months, especially just before and just after Christmas, will be a challenge. We meet daily to discuss length of stays, and those people are awaiting discharge, with our colleagues in health. We have a live dashboard, so we can monitor patient flow and we can understand and predict what the needs are coming through. And then we have a twice weekly escalation meeting at a senior level to pick any barriers that we're facing and to consolidate our resources on any areas of concern.
Thank you, Sharon. I think that gives a clear assurance that this has been managed effectively. So thank you, and thank the team for all the hard work that they do.
Thanks, Councillor Chris.
Can I just follow up on that point, Sharon? The Health Authority have made changes last year around their processes for moving people that are out of hospitals. I think Llandudlwys and Broncliffe, it's like, if I got the two hospitals right. Have you seen any impact of that change in provision from your services side?
Think it's taken a while to bed the processes in, as with any change. It takes a while for that to settle in and for us to understand each role and responsibility. We have now dedicated resources in I think you're referring to the ready to go home units at Brecon and Llandudlwys, and the staff are working really well now. We've seen a reduction in the time taken up by practitioners having to move around the different sites, and actually we're strengthening the MDT now at those two sites, which I think is seen an improvement in discharges, but it's taken a while for us to get there, and there's probably further work that we could do on it.
Okay, thank you. Yes, Councillor Ange.
Morning, Sharon.
Morning.
Just a sort of quickie. Are we sure that the discharges are going really well, by the way? Actually, they're going really well. People are getting out a lot quicker. I'm a little bit worried about the two-person handling discharges because they seem to be a lot slower, obviously because of staff, and they're coming through a lot more to us, Powys team, rather than going through to the teams from private companies because they haven't got the staff, and we sort of have to have it. It's more that when they get home, for instance, this week I've had somebody come home with a two-person discharge. Got home at 11:30 yesterday morning. The carers arrived at 12, so the ambulance literally just dropped them off and whatever. But there was no food or anything in the house for them because they'd been in hospital for 8 weeks. And it's the sort of more linked up part of it that we need, from what I can see, where the OT hadn't been out to check the property was right and that they'd got the right equipment. Luckily, they had, or equipment that will do for now. Anyway, let's put it that way. But it's that panic of them getting home. One, there being nobody there. This person is very disabled in an electric wheelchair. And how our care team isn't under contract to go and do food shopping and things like that for them, which they shouldn't be because they're carers, then, if you see what I mean. It's just, I'm a little bit worried about some of the link ups between the fact that the hospitals are getting the people out quicker. Yeah, that's great because they really want to go home. But the arrival at home, and that then put a great deal of pressure literally onto our girls because they rang me and I was there when the girls arrived to help because he doesn't speak very well, to help him. But I went out then and did his food shopping for him. Absolutely fine, not a problem with me. But you're not everybody is always there, hasn't always got somebody there. Our girls aren't employed to do it. They're not employed to do his washing. There's somewhere there's not quite a link up. There needs to be just a link up. I'm sorry to put that
No.
forward, but it's just the link up. Yeah, just the link up for them to get home.
I think it would be
Okay,
useful,
thank you.
Councillor Ange, if we made contact outside of this meeting so I can understand that specific individual situation a bit more, and to make sure that it's right moving forward.
Yeah.
There are things in place that should prevent this from happening. So we have our community connectors, which are attached to the ready to go home units as well. And we should be having conversations around exactly that. What is the person's circumstances returning home? It isn't, as you say, it isn't just about the care package or the equipment. It is around, are the utilities working? Is the house inhabitable? Is there food in the fridge? Medication on discharge? Does the person understand their medication? Will there need to be, different conversations with the local pharmacy, etc., etc.? And some of those things should be captured by the social worker, but also we do have that community connector that is solely focused on supporting on those softer side
Yeah.
issues
Yeah, well,
moving
it was our
forward.
girls I was thinking about, or our employees. I shouldn't say girls, sorry, they just happen to be girls in my area. It's our employees I'm thinking of because, like, obviously they were quite upset when they come in to do lunch and do all these forms. What time do you want your visits and all of the usual sort of things that they do because they're absolutely brilliant. The girls are so good, so nice, so kind and caring. But I felt really bad for them because there wasn't actually anything there that they could do. So, like I say, we went through a shopping list between them and this particular client, and I went down and did a bit of shopping, and we went from there. But I don't mind doing that. That's not a problem for me. But
And maybe we could
not
review.
everybody has got a me, and if it's
Yeah.
happened to one person, it's likely to be happening in other places. That was what was worrying me, really.
Maybe yourself and I could chat about this
Yeah,
outside of this
yeah,
meeting, and we can do a bit of a review of the case and then widen the learning out, and I can speak to the teams and see if there's anything we need to change for some of the processes. I can also then highlight the update the guidance and speak to the community connectors as well as the social workers attached to the ready to go units to make sure that those things are being discussed prior to discharge.
yeah. It was just really quick. He knew the night before he was coming out and was home by 11:30 the next morning. It was just which was great. He's absolutely over the moon. Don't get me wrong, and the good and our staff are brilliant. But yeah, thank you for that. It's just something we need to keep an eye on, really.
Yeah, thank you.
Yeah. Thank you. I am aware of time, and Councillor Amanda has just returned, and we are just before 11 o'clock. Any other questions around finance? Any points that Anne or Amy wants to make?
Gareth, has the question been asked about the debt write-off?
Oh no, sorry. Thank you for reminding me. Over to you, Amanda.
It was just a quick question on where you've had the debt write-off in adults. I just had a quick question on what lessons have been learned from that, and so that doesn't happen again. And was that just in relation to one service user?
Shall I come in, Council Chair?
Thank you. Yeah.
Yeah, yes, there was one large amount written off regarding one specific person, and that was we were in arbitration around a specific case. We have been doing a lot of work around debt write-offs in the last 8 months. We've actually written additional guidance for the social work assessors to actually prompt them to have discussions with individuals at an earlier time around any accruing debt, increasing their awareness of the finance implications, and we've got additional resources that we've put into the teams to make sure that we're being more proactive around that area of work.
Great. Thank you. Thank you. Okay, well, I think we're now ready to move on to the next agenda item, which is the North Powys Wellbeing Hub. And if I missed any of any recommendations or action points on that, if we could just make sure we've got a note of those, please, that would be great. But yes, we've got a good time period now to really look at where we're up to with the North Powys Wellbeing Hub. It's been a while since it's been to Scrutiny. And so I'm going to hand over to Nina to introduce it. Nina, I'd be really grateful if you could please also introduce our health board colleagues that we've got in the meeting today as well. And if whenever you are brought into the session, if you could please just explain what your job role is, that would be brilliant for the public to know. And then as part of your update and the presentation today, we've got part of it in public session and then part of it which you want to have in private session, which we'll get to shortly. But it would be really helpful to have a quick overview on the journey to date It's been a long one, and so the public are aware as to where those hurdles have been, and going forward, what are the biggest hurdles still to overcome. And on that note, I will hand over to Nina, please.
Thank you, Chair. I think Councillor Peters, portfolio holder, would
Oh,
like to say a few
thank
words
you.
first,
Thanks,
and then
Nina.
I'm happy to start the presentation and introduce colleagues from the Health Board. Thank you, Chair.
Thank you.
Thanks, Nina. I just wanted to bring people's attention to the fact that this is a combined outline business case and strategic outline case session. This is not the final product. There will be a lot more work and engagement to do if this stage is met with approval and permission is given to go ahead to bring forward a full business case. The project itself is phase one of a larger project in Newtown, and you'll hear about that from officers as they go through the presentation. But it establishes the hub wellbeing primary care interaction that frees up land elsewhere within the immediate area that will facilitate a replacement for the Newtown Hospital. We have with us today Nina, who's the Senior Responsible Officer from Powys County Council, and Lucy Cornish, who is the Senior Responsible Officer from Powys Teaching Health Board, and they'll introduce their colleagues that will be sharing information with you today. And I'll pass you across to Nina now, who'll take you through the presentation.
Thank you very much, Chair, and thank you, Councillor Pete. As Councillor Pete has said, Lucy Cornish and I are the joint senior responsible officers for this project, and we're here this morning, and we're supported by a number of colleagues. We've got Neil Clutton from Powys County Council and Wayne Tannehill as well, and perhaps we ask if they could introduce their job roles when they speak for the first time. I'm going to try and share the presentation now and be grateful if you could confirm if you can see that or not.
We can, but it's rather small. So when you
I'll put it on slideshow, yeah.
Yeah, put it on slideshow mode, that's it. Thank you.
Brilliant, thank you. Okay, so we're here today to provide an update on the development of integrated healthcare and wellbeing hub in Newtown. So this is a real key cross-cutting priority for the Regional Partnership Board and its strategic capital plan, which acts as the overarching programme business case for all of the bids that go through IRCF. So in front of you today is the SOC OBC. So we're due on a trajectory of timescale to submission to Welsh Government by the end of December 2025. In terms of that, we've got some key dates provided on this slide for you. So we've currently, if you can see the key dates that we've been through previously. So in terms of March, 12 months ago, December 12 months ago, a bid for IRCF money, which was approved then in March of this year. That was to help us to develop the SOC OBC submission, which is in front of you today. That would then be presented by the end of this month, with a decision expected then in Q4 of the financial year. If we get approval to continue to the full business case, that would be submitted then in Q3 of next financial year, with construction then looking to start in Q1 of 27-28, and the anticipated completion date at the moment in terms of towards the end of 28-29. So the presentation today is going to provide you a brief summary of the business case, address questions that have risen during the process, and take you through some more information. So, sorry, just move on. So the business case process, so where we are. So the programme business case, or the PBC, for the North Powys Health and Wellbeing Campus was endorsed by the Welsh Government back in 2022. So the programme is a once-in-a-generation opportunity to bring together partner organisations to transform the way services are delivered in North Powys. So this business case focuses on phase one, which is the development of a healthcare and wellbeing hub. And as I said, a real cross-cutting priority for the Regional Partnership Board. So the stage we are now is the combined strategic outline case and outline business case, or SOC OBC. So the SOC OBC focuses on confirming the strategic fit. It identifies the preferred option that optimizes value for money and sets out the broad procurement strategy and management controls. So really important, this is not about having all of the detail agreed and finalized at this stage. It's about that strategic level fit and identified preferred options and broad kind of strategy. So I just want to make that really key. The key questions that need to be addressed is about the strategic fit. Does it align with objectives and policies? Why is the change necessary? What are the possible options on the way forward, and is it affordable? So if the SOC OBC then gets approved, the next stage would be the full business case, or the FBC. And that's where the detail comes in terms of procuring the solution, contracting the deal, really finalizing all the detail in terms of the build, but also the service delivery within the building, and comprehensive delivery plan as well. So the business case summary. So within the information that you've been provided today, you've got, I understand and appreciate, a really significant amount of information. So we're just briefly summarising on the next couple of slides that information that you've been provided with. So the strategic case is the first of those. So this is about setting out how the new hubs is a significant step forward, delivering integrated, person-centred services in North Powys. It's bringing together health, social care, education and third sector partners into the campus, and it addresses long-standing challenges across the county and the north of the county. The scheme is strategically aligned with national and regional priorities, including the Wellbeing of Future Generations, Healthier Wales, Social Services and Wellbeing Act, and of course the Powys Health and Care Strategy. It supports the Regional Partnership Board's ambition to shift the balance to prevention and wellness, tackling inequalities and improving outcomes across all age groups. The second case included is the economic case. It's a really important part of the submission and demonstrates that the proposed investment offers social value, delivers optimal balance of costs, risks and benefits. And within the detail in the pack, there's 3 shortlisted options. So there's the do nothing. So obviously the low capital investment, but it would fail to meet the strategic priorities, the service transformation, or the long-term sustainability aims and objectives. The second is the integrated hub, which is the preferred option, which delivers clear alignment with criteria, the prevention agenda. The new build would negate issues with the existing state and delivering net zero carbon and compliance and in terms of risk as well. And of course, then there's the campus, which includes the hub, much broader benefits beyond prevention when we're looking at later phases, but this comes at greater cost. So we'll be looking at that in due course. We've got then the commercial case, which sets out the technical, considers the procurement approach for the construction contract. It's important to establish that there are viable procurement options and choices that can support the project success criteria. So all of that consideration is considered within the commercial case. And any questions on that, we will be asking to take into a confidential session. Likewise, with the financial case, we've provided very high-level summary here. So detail in the capital funding for the project is around the target capital cost is plus or minus 10% of 32 million. And detail, I'm happy to look at in more detail and confidential. But of course, we will work through more detail as well as part of the full business case stage of the business case. Just a note here at this stage as well, the forecast revenue position indicates a revenue neutral position for services or better. And that is the current position where we are in terms of revenue. The management case arrangements for the North Powys Wellbeing Programme have been established to make sure we ensure effective and timely delivery of the hub to required criteria of cost, quality and performance. So governance is provided through the Regional Partnership Board with project oversight managed by the Innovative Environment Project Board, which has representation from Powys Teaching Health Board, Powys County Council and the third sector. And senior responsible officers, Lucy and myself from both the Health Board and the Council provide strategic accountability and ensure alignment with organisational priorities. And Chair, I'm going to hand over now to Lucy Cornish to cover the next few slides.
Thanks, Nina. Just to introduce myself, Lucy Cornish, I'm the Director of Improvement and Transformation in Paris Teaching Health Board, and as Nina has introduced me, the joint SRO for this programme. So just in terms of the business case and key points for Welsh Government, you just see here in terms of some of the lessons learnt on this slide from other projects across Wales and wider. So Welsh Government IRCF leads to require the proposal to demonstrate that we've taken learning from other integrated hubs and can be seen to have incorporated some key principles. So the key elements that we've brought across into our work are the efficient use of space, so that buildings are functional but are not bigger than they need to be, with associated capital and revenue impacts. So, for example, no huge atriums within the design. We need to beneficially use every square metre of the hub so that we can really promote that integrated working and avoid any silo working and underutilisation of the space. In terms of room booking systems, we've ensured that the core dedicated space for each service is needed to deliver their core service, and we will be putting booking systems in place to maximise usage and enable access to the wider hub community. They must be user-friendly and state-of-the-art to enable that culture shift. From a sustainability point of view, we know that there's a requirement for the hub to meet net zero carbon standards, but also to be affordable from a revenue perspective. And that's something that the team have been working through as part of the business case. Rationalisation of the public sector estate. So this is collaboration and not co-location by providing joined up services under one roof and disposing of older fragmented estate as we are able to. And then in terms of net to gross floor layout plans, this is around the efficiency of the space. And at the moment, this programme is working to a comparable level with the best performing hub that we have had shared with us as an example. And we're looking further to improve that. And then the next slide, please. In terms of alignment with key IRCF objectives to meet the requirements of the funding, you can see here the objectives that are listed around co-location of services to enable seamless delivery, a hub and spoke network of integrated facilities, a no wrong door principle, graduated response, town centres first, proportionate and planned investment, and decarbonisation. And you can just see there on this slide some examples of how the North Powys hub will meet these objectives. And if I just take one or two examples from those, so the hub will provide improved access by providing a front door to services, and it will provide a place and space to support community-led activities as well as help support advice and wellbeing services, which helps us to meet the no wrong door principle. Next slide, please. In terms of our investment objectives, a benefits realisation plan has been developed as part of the SOC OBC, which details our benefits, baselines and measures under each of the 6 investment objectives. And these will be further defined during the full business case process. So these include integrated local services, so creating an environment that promotes that seamless collaboration with all partners and removing barriers to strengthening community services. Innovative environment, so providing safe, welcoming and flexible and digitally enabled spaces that help to foster innovation and support the provision of services in a fit-for-purpose environment. Decarbonisation, so delivering a climate adaptation approach while championing the use of low-carbon technologies to make sure that we're meeting that objective. Flexible, sustainable workforce, so implementation of a flexible and sustainable workforce model built on collaboration and strengthening of recruitment and retention and the expansion of career development opportunities. Regeneration, so generating opportunities to optimise social value through stimulation of the local job market and creation of a new community venue near the centre of Newtown, which we have obviously the health and social care and wider wellbeing offer being delivered from. The fit for purpose estate, so it providing safe, efficient and compliant accommodation that improves our utilisation, reduces backlog maintenance and makes the best use of public sector funds and assets. Next slide, please. So in terms of what difference phase one will make, the hub will enhance access to early help and community-based support through joined up and easily accessible services with a strong emphasis on prevention and proactive care and that early intervention. It will support individuals to manage their own health and well-being, helping to reduce dependence on statutory provision. So examples of this include, you can see here dental, so an increase of dental chairs from 3 to 5 to help reduce waiting times. And we know this is a key pressure point in the North Powys area, and that will help people to avoid having to travel out of county for services. From a training perspective, with the academy being sited within the building, we will be able to offer continuous professional training, placements and apprenticeships, helping to attract and retain skilled staff locally. And this is something that we don't currently have an academy within the North Powys area. So this will be an additionality for North Powys. From a library perspective, this will offer a welcoming, stigma-free space that encourages community use and complements the other services, and it supports health literacy, digital inclusion and lifelong learning. Lifestyle, flexible, bookable rooms will allow healthcare and third sector partners to deliver a wide range of wellbeing and lifestyle activities under one roof. And then from a family's point of view, these services are currently being delivered from at least 3 sites in the Newtown area. And this will enable us to bring statutory and non-statutory services under one roof, creating a more holistic offer for families, while staff can benefit from a multidisciplinary approach. And then an enhanced integrated primary and community care offer will be delivered from the hub, which will ensure our focus on prevention and reduce the need for people to travel out of county for hospital appointments. And that's very much aligned with the national emerging community by design approach. Next slide, please. So these next 2 slides just provide some more detail around some of the benefits from a service delivery perspective. I won't go through all of the boxes in detail, but just to highlight some of the elements here. You can see from a children and families point of view, as I've already stated, brings those statutory and non-statutory services under one roof. But it allows us to enhance our multi-agency collaboration across all sectors, improving timely identification of needs to prevent escalation into more complex issues. They provide a child-friendly environment and ultimately will lead to better outcomes for children and families. And you can also see from a mental health point of view, it will allow us to better join up our physical and mental health services for people in the area, bring us closer collaboration with third sector and wellness services to promote mental and emotional well-being, and includes design principles that promote inclusivity and dementia-friendly environments. Just next slide, please. This slide gives some further detail just around some of the benefits in relation to prevention and wellbeing, the integration of services and the library and resource hub. From an integrated services perspective, the integrated community practice by health, social care and third sector will support early intervention, helping reduce avoidable hospital admissions and delayed discharge from hospital, so helping people to get home quicker. Integrated pathways for adults and children with physical and mental health conditions will improve continuity of care to our population. And I will move on to the next slide if it's okay. So I'm just going to hand over to Wayne Tannehill now. Over to you, Wayne. Thank you.
Yes, thank you, Lucy. And my name is Wayne Tannehill. I'm the Associate Director of Capital Estates and Facilities with Powys Teaching Health Board. So this diagram shows the degree of proposed consolidation of the estate. Welsh Government encourage rationalisation of premises, which means that we will operate from a smaller footprint in a joined-up way from modern, fit-for-purpose buildings. In addition to the integration of 6 public sector buildings, we are also in dialogue with GP and pharmacy partners. The hub will also provide some additionality in terms of education, training, an academic library and other services. So if we could move on to the next slide. The campus slide helps remind us of the broader ambition and the inclusion of the school and, as phase 2, the rural regional centre, which is the relocation of the hospital in Newtown. The image gives us a sense of adjacencies, scale, and the overall planning intent. Buildings that staff will relocate to the hub from outside the campus footprint will be considered for use as key worker and student accommodation as part of the next stage of development. So we will pick up some further detail on the site as we progress through the further slides. So if we could move on, please. The image of the proposed integrated hubs gives a sense of how the building will sit in the parkland location. There is an adjacency to the south with the ancient monument, the Motte and Bailey Castle, and clearly sensitivities when we come to the build about the potential to find archaeology on the site as well. So we are planning for this and undertaking investigatory surveys. The area generally known as Plot B, to the north of the proposed hub as well, also holds a critical importance to the community. This is really well understood and is incorporated into our thinking as we develop our way forward. The image also shows the important adjacency to the town centre via the avenue to the east. Thank you. The image, which has kindly been shared by Haven Aravon, gives a good aerial view of the park and identifies the key partners, Open Newtown and the Oriel Davis Gallery. It's a really great visual of the activities, Newtown Carnival in this instance, and the high levels of community engagement in this space. We are setting up regular meetings with Town Council, Open Newtown and Oriel Gallery to work together on enhancing the use of the external space with a particular focus as well on Plot B. Thank you. Some of the visualization imaging is really helpful to give us a sense of how the building will sit in its parkland setting and relate to the adjoining quite modern looking buildings, again, Oriel Davis Gallery and Haven Aravon. We're clearly conscious of net zero carbon when choosing materials and are aware of the longer term maintenance implications. And we're taking learning from the school programme, and I know Neil Clutton's on the call as well. So Neil's working really closely with us. And, you know, we do understand large areas of timber, for instance, incur future maintenance burdens. So we're very thoughtful about our material selection in terms of the visualisation, but also future revenue potential burden as well. Thank you. So the internal imagery conveys a warm, welcoming approach with a clear desire to avoid an overly clinical feel to the space. Wayfinding will be important for visitors, and this will be intuitive and carefully thought through. The image to the right of the screen gives an indication of adjacencies of services across the 2 floors of the building. This has been developed to ensure connectivity between key services, but also addresses the important safeguarding and quiet space needs that we understand users have expressed to us as part of the design evolution of the building. Okay, thank you. The courtyard, so there's a couple of courtyards in the building. They will provide 2 internal spaces which have important and defined uses. The family centre courtyard, which is shown here, can be locked down for activities and play sessions and is immediately accessible from the family centre. The second courtyard provides a quiet contemplative space to support mental health activities and well-being, with a further green space and sensory garden located outside the building. The courtyards generally improve the sense of light and well-being within the building and help orientate people around the hub. Okay, thank you.
And I think it's back to myself
yes.
now. Thank you, Wayne. So engagement has taken place with a wide range of stakeholders through this process. So that includes the public, staff, councillors, which is county councillors and town and community councillors as well, residential neighbours, third sector groups and other key stakeholders. And obviously, you know, there has been previous engagement work over a number of years as well. Recently, we've held public drop-in sessions online, and we've had a paper survey as well, with more than 280 people engaged. So feedback received, we've included a flavour, but you have got a full report within the pack as well. So there's strong support for the integration of services. There was some mixed views on the location. Some people really welcoming the proximity to the town, welcoming the modern building design, etc., but others concerned about the removal of the park building that's currently there. There's been concerns raised about the amount of parking proposed on the site. So the team have taken that away and looking at how we can be doing something differently or mitigating this. Some stakeholders expressed worries about reduced space for services, hot desking proposals, separating out of staff and the relocation of the public library. And also throughout, there was a clear call for continued engagement as we progress the project, especially as we move into the full final business case stage as well. So just the last slide now, just this is giving you an idea of the governance timetable and process that these reports have been through. So we're now obviously the 12th of December with yourselves, health and care scrutiny. And then the papers are due to go to Powys County Council Cabinet and to Powys Teaching Health Board for approval on the 16th. So that's on Tuesday of next week, before going to the Regional Partnership Board on the 18th of December. And then be submitted to Welsh Government thereafter. So I'll take those slides down for now and we'll pause there for any questions. Thank you, Chair.
Thank you, Nina. Amanda's had to dip out for a few minutes, so you're left with me again. Any questions, members? I think there's a lot to take in there. Can I just start by asking one question around the current park building? I assume it's not listed at the moment. Has any action been taken to ensure that, we've had cases in the past when Ysgol Massey, for example, in Welshpool, was listed just as the council was about to knock it down and had plans for it. Is there any action being taken around the park, around listing, etc.?
Could we ask Wayne or Neil to come in and respond to that, if that's okay?
I'll jump
thanks,
in.
Neil.
Hi, Councillor. Yeah, I think we are aware there's always a risk. We've had the planning officers on site and the and others looking at this. We could look for a listing protection, but we haven't sought that at this stage. We don't feel it would warrant a listing at this time. It would be a difficult one to list, I think, though it is considered a risk because we're in the conservation area. But we're not seeking to protect from listing at this stage.
Okay, is that something that should be considered?
We will have to consider more conversations being had going forward with the historic officers and so forth. But I think the problem is with applying for listing protection, it does focus people's thoughts on going, well, why are you seeking protection from the listing? So
does Neil just cut off?
Yeah, I think we've maybe lost Neil, Vice Chair, for a few moments, but I'm sure he'll be back soon. Thank you.
Back to you, Amanda.
Thank you. Thanks, Gareth. Apologies to the committee and to the public. I've just got some issues going on at home that I need to sort out. It's obviously quite high level still, and that's, to be expected. But that will obviously mean our questions are quite high level as well. But what we would want to do as a committee is once you have a more specific list of planned integrated services and shared services and exactly what those co-sharing arrangements look like in terms of social services, where we would like sort of a list of those services that are going to take place on this site so that we can then decide as a committee how we look at this going forward. As a committee, we are set up with the health and social care remit, but we're not set up with the remit to scrutinise the educational side of this where the school is or the buildings or anything like that. So one of my overarching questions is what is the governance and scrutiny arrangements for the building and the education and everything that sits outside of social services and health, because I know the health board obviously have their own governance arrangements in place. So that's one of my overarching questions. I'm just going to ask a couple of them before I hand over, and then perhaps Nina, you can identify who would be best to answer each one. You've answered about local member engagements, but I just wondered, is that dialogue open and ongoing, or is that still to be developed? Have they just been to the drop-ins, or how are they involved in all of this? Or how do you envisage they'll be involved in all of this as it develops? In terms of the integrated shared services, where there's crossover with social services, who will be leading on the governance arrangements for that, in terms of developing job descriptions, budget apportionments, whether there's any changes in service provision rather than just co-location, whether there's any specific types of services that will be really new and innovative. I can't say that word. Innovative. I can't say it. Sorry. It's been a long night. And how can we be involved as a committee in scrutinising those kind of things? And then my last sort of overarching question is that obviously this has been going on for years, which is to be expected, but we are expecting an election. Well, there will be an election in the Senate next year. We do not know the outcome of that, and we're not going to speculate or bring in any kind of party politics in speculating on that. However, my question is, if there was either a change in leader with the current government or a change in government of any for any party, how much of this is set in stone on the trajectory that it's on, or at any point could this all be halted or reversed, or are we far enough into things for this to still carry on, or is the whole thing very unpredictable? And I shall leave it at that because there's quite a few little bits there.
Thank you, Chair. That's quite a long list, so apologies. I'll try to work my way through that with colleagues as best as I can. I'll ask Lucy to come in a moment in terms of the programme structure and service redesign work streams that are ongoing as well. In terms of timescales for this, as I said earlier, we are looking to submit in December to Welsh Government, the SOC OBC. The current expected timescale would be for a decision to be made in February, March time of 2026. So would be in advance of going into a pre-election period. So and then we would have approval to continue to the full business case. Then that would give us that kind of approval.
So once that decision's made in February, if it's the go ahead, it can't then be undone.
Well, we'd be given permission then to proceed to full business case, which would then be submitted. I think off the top of my head would be Q3 of next year. We would have that approval. In terms of health and care scrutiny and your involvement moving forward, as you said, you're obviously very interested in the social services elements and the interactions and the integration around that. There is within the pack included service brief information. And I think perhaps obviously we want Scrutiny to be very involved moving forward. We could look at those service briefs, and perhaps you could choose some areas that you really wanted to focus on. We'd be happy to do that in committee with yourselves, or if you wanted a working group, etc. I'm happy to be led by yourselves as to the level of involvement that you would like. But we'd be really keen and would certainly value your committee's input into that kind of piece of work. In terms of governance arrangements, it's going to Cabinet now next week. So that's across the whole of the SOC OBC. I know today we're just focusing on the health and social care elements of that. In terms of member engagement, as you said, there was also the online, there was in-person drop-in sessions in the locality. There was online and paper surveys, but we also held meetings with town and community council representatives, which I attended, and we also did a briefing session for all county councillors as well. So that's just the most recent engagement. So that'll be the October-November engagement as well. So just to highlight that, and perhaps I could just go to Lucy now in terms of she could add some bits in if that's okay, Chair. Thank you.
Thanks, Nina. So yeah, obviously moving forward, just in relation to the engagement, we would have a full engagement plan as we move through into the full business case, of which local member engagement would be a part of that full engagement plan. Just in relation to the service design element, so Nina has referenced the service briefs that are included as part of the SOC OPC documentation. So those have been developed with service leads through the service redesign work stream, of which we have a health work stream lead, and we also have a Powys County Council work stream lead, who is Sharon Fruin from your team. So well represented, and that's where those conversations around the requirements of the service and the future integration and how those services will work together to deliver a target operating model will take place. So just to provide assurance that the programme is structured to have those work streams in place with appropriate leadership to make sure that those conversations are happening so that we can optimise the use of the hub and the integration benefits that we are seeking to achieve through the development of the hub. So I just wanted to confirm for your assurance in relation to that as well. And that will continue to develop at a obviously more detailed level as we move towards a full business case as well. Thank you.
Thank you. Councillor Peat, did you want to come in on any of those questions?
Yeah, I was going to come in on the education one, wearing my old hat. The school part of it falls under the Sustainable Communities for Learning, so it has its own governance process. It will go through the same SOC OBC full business case as the hub, and that will be available to the Learning and Skills Scrutiny Committee to look at if they choose to do so. So it is a separate process, and whilst it's part of the wider phase 1, 2, 3 type approach, it's not dependent on the discussions that we're having today.
Thank you. Councillor Gareth.
Yeah, just a couple of questions. What geographical area do you expect this provision to serve? I know it's called North Powys, but will it come into Radnorshire? Because I'm aware that parts of Radnorshire are a lot closer to Newtown than, for example, Welshpool. So I'm just wondering what, and on that process, when do you expect the planning application to be available to go to the planning committee? Or the planning, when do you expect to submit the planning application?
Thank you, Chair. I think Wayne would be best placed, or Neil, in terms of the planning query there. And perhaps Lucy, would you mind just confirming in terms of the geographical area?
Yes, thank you, Nina. I'll come in on the planning application. So at this stage of the business case, we would really be looking at sort of outline planning or pre-application planning. The full planning application would be done in conjunction with the full business case, which would be next calendar year. So does that address your question?
It addresses my question, but I think it's a very tight timeline, isn't it, to get the plans in place and allow the planners the appropriate time to actually consider that application.
We've had a very active pre-application
Okay.
discussion with the planners. We've also taken a presentation to Design Commission for Wales. I'm not sure if you're aware of that particular body, but they're set up by Welsh Government to scrutinise public sector. It does tend to be health and other public sector buildings in terms of value for money and the quality of the design. So we've had quite a favourable report back from the Design Commission for Wales, and that is really helpfully the planning team, the heritage officer from Powys attended that meeting with that particular body as well. So there's an awful lot of dialogue that's happening at the moment. So we have a good degree of assurance around the nature of the design that has been developed.
Okay, thank you.
Can I just add, Councillor Gareth, that our planning officers and the heritage officer, conservation officers have been heavily involved from an early onset in the project, and they're working well with us at the moment. So,
okay.
Chris?
No, they haven't answered the second part of my question.
Sorry, Gareth.
Do you want me to come in on the second part of your question? So just to answer that, so obviously the scope of services that are proposed to be delivered from the hub currently have a variety of existing geographical areas to which they serve. So the service redesign work stream and the existing service briefs have been based on the existing geographical areas, but then looking at what the opportunities would be to deliver more from within the hub. We need to be conscious of not then having a negative impact on access to services for elsewhere in the county and where services are currently being delivered. So that will all be worked through in detail to make sure that isn't the case, and that we are continuing to optimise access to services as we deliver the hub, and hopefully more innovative and enhanced ways of delivering services to the North Powys population. I hope that answers your question. So I think ultimately it's varied at the moment.
Yeah, thank you.
Thank you. Councillor Chris.
Thank you, Chair. It was mentioned that there had been some consultation with various people, including the public, and I just wanted to get a flavour of what the public's view of the present proposal is.
Thank you, Councillor Chris. I touched on briefly on one of the second to last slide, kind of a flavour of some of the comments that brought back. But there is within your agenda pack, there is a detailed engagement report which takes you through kind of the feedback in terms of the recent engagement that was undertaken. So if you've got any further questions on that, I'm happy to take detailed questions on that engagement report.
Did you want to come back on that, Chris? Are you okay?
No, it's okay. I mean, there was over 700 pages in there, so forgive me, I haven't gone through every line on it as yet. But
no,
thank you for
absolutely
that clarification.
Yeah, absolutely appreciate that, Councillor Chris. But if you do have any questions later, please don't hesitate to contact me, and I'll be happy to pick those up.
As a general point, it's really hard for us to pinpoint the areas because there's so much in there that's to do with the building and the design of the building and the planning, which goes on for, a significant amount of pages, that it's quite hard. I'm struggling to find where the service briefing information is as well within there. So I don't know if we can maybe going forward be assisted in perhaps using Copilot to help us get to where we need to get to within these reports. Because our agenda pack today was it was under 800 pages, but over 700. Councillor Josie.
Thank you, Chair. It's just regarding public transport to and from the hub. Obviously, we've spoken about car parking, but I haven't yet heard anything about how residents and service users may be travelling back and forth to the hub, and what engagement and what information has currently been put in place to deliver a return home system and the safeguarding. We always hear that people are left stranded, perhaps using public transport and buses. I'd just like to perhaps hear some of that, if not now, at a later date, Chair, please.
Thank you. Yeah, I'm sure. Is that something that we can be provided with going forward? Neil, is that something you're able to answer? Oh, you're on mute, Neil.
Apologies. I have attended quite a few of the public sessions, and they've gone really well. I'd like to add the travel plan aspect is being worked through with its services and the council's officers as well. So there's a lot of work to be done yet, but I think the actual detail about what the council's mentioned at the moment, I haven't got that detail at the moment. Sorry. So, but
Yeah.
what I would say, most of the consultations we've had to date, a lot of it's been surrounding the building, the framework of the building, how it looks and so forth, and where it's located. I haven't had a lot of detail on the actual service side provision, but I'm sure that's there in detail.
Could I just add in there, Chair, that
Yeah.
one of the positives of this site is its excellent communication links in terms of public transport. This is a town centre location, very, very walkable for, very significant number of the population from the Newtown area for a start, supported by active travel, etc. But also in terms of public transport, it's adjacent to the bus station, it's adjacent to a large public car park. The train station as well as would be within 5-10 minute walk as well. So it is an area and a town centre location that is very well served by public transport, which is one of the positives. And Councillor Josie, you're absolutely right, making sure that people are aware of those public transport opportunities and that they will link and work well is really important. So thank you for raising that.
Thank you. Councillor Gareth.
Yeah, just a couple of questions. How does your timeline match up to the timeline for the new school? Because I'm aware of the issues around transport at the start, traffic at the start and end of the school day, and something needs to happen around that, I assume, longer term. The other part of the question is, there are current services being delivered from the buildings that are going to be, the park, for example. How are you going to maintain those services during the construction phase?
Thank you. I think perhaps, sorry, Neil, do you want to start here?
Yeah, I think in regard to the building usage, we've got several buildings in the area, Councillor Gareth, which we can utilise to help us decant from the park office and other facilities going forward, such as Ladywell House and so forth. So I think we got a piece of work to do on that in detail as part of the scheme. There is an issue with the alignment with the two projects. They are very much aligned now. Whether we can construct at the same time is a different thing. So part of the work we will be doing going forward is trying to develop better pedestrian routes into the back of the existing school site towards Avon House as well. So that will create a safer movement of people, persons coming into the sites from different directions going forward. So, and hopefully that can resolve a lot of the issues that are currently on the site at the moment.
Okay,
That answer your question, Gareth?
Yeah, I think.
Any other questions, councillors? No, in that case, then, could you introduce, please, Nina, the reasons why we need to move into confidential session for the next part of this?
Yeah, thank you, Chair. The request is to move into confidential session so we can cover the financial, the capital, the revenue, and the commercially sensitive information, because that would be, as I said, sorry, commercially sensitive information best discussed in confidential session, please. Thank you.
Is that because of procurement and tendering and stuff like that? Okay.
It is, yeah. Thank you, Chair.
Councillors, I think I need a proposer and a seconder that we do this.
I'm happy to propose, Chair.
Thank you. Chris, is that you seconding? Or Josie?
Happy to.
Okay.
Yeah, happy to.
Thanks. On a show of hands then, is everyone happy to do that? Yeah. I think that's okay. I can't see everyone's hand, but no one's spoken up. So in that case, can I move that we go into confidential session, please. And I'd like to thank the members of the public for listening today. And yeah, please keep watching our health and social care scrutiny committees.